The spiraling number of Ebola cases in the Democratic Republic of Congo has now climbed to more than 900 since the outbreak began in the North Kivu area in August. Doctors Without Borders, whose health workers just returned from the region, say the Ebola response in the Central African country is failing to contain the outbreak.
More than 40% of the deaths are right now happening in the community. That means that we have not reached them and they have not sought our care. 35% of the newly infected people are not known to a chain of transmission, meaning we don't know how they got it.
The medical charity group, also known as MSF, recently suspended its activities in the Katwa and Butembo treatment centers after those sites were attacked. But centers in other areas remain open.
What is clear is that there is a great hostility against the whole of the Ebola response. In the last month alone, there were more than 30 different incidents and attacks against elements of the response.
The problem is compounded by local distrust of authorities. Dr. Anthony Fauci with the U.S. National Institutes of Health says more must be done to win the community's trust.
They've had a very difficult history in the Democratic Republic of the Congo. They've had oppression, they've had rebel groups, they've had political instability. So it's very difficult to get the people in the grassroots level to trust the medical authorities, particularly when they see them come in with protection, armed protection.
Deputy Mayor of Butembo, Kambale Tsiko Patrick, compares the armed groups to terrorists.
Their targets are no longer the army or the police. Their targets become health structures, because not only the Ebola treatment centers are attacked, but also some other health facilities.
Elsewhere on the continent, Madagascar is fighting against a measles outbreak which has claimed the lives of nearly 1,000 children in the last 6 months.
If a person with measles is in a room with 10 other people who are unvaccinated, 9 of them will get measles.
The highly contagious disease is easily spread by sneezing and coughing, and its impact can be devastating, says Dr. Fauci.
1 in 10 children who get infected with measles will get an ear infection that could cause deafness. 1 in 20 would get pneumonia. 1 in 1,000 would get brain swelling, what we call encephalitis, and 1 to 3 per thousand would die.
The World Health Organization warns the number of measles cases is increasing worldwide, and without action, the outbreak could lead to a global epidemic. Despite some successes of vaccination programs in some countries, infectious diseases are still a leading cause of death in many other parts of Africa. Mariama Diallo, VOA News, Washington.